Hello and welcome to the new case talk for patients starting chemotherapy. You should be attending this talk if you have been told by a consultant that you'll be starting a course of chemotherapy. You may have received a pack in the post which has given you information regarding your appointment for your new case talk, your treatment, and also when you'll be seeing the doctor. You will have also received lots of information leaflets on how to stay well during treatment. So, what to expect from today's new case talk? This talk will provide information and guidance for friends and family and yourself on how to stay well during treatment. We will also give you specific information about your treatment and including any other questions that you may have. After watching this presentation, you will get a call from one of our nurses on the time slot specified in your pack. This appointment is for 15 minutes, and this is where the nurse will speak to you about any concerns you may still have after watching this presentation. The nurse will also speak to you about possible side effects for your individual treatment. This talk is also to help answer any questions which you may still have regarding starting chemotherapy. Feel free to make some notes and jot down any questions which you may have that is not clear in these slides, or you may have that do not get answered during this presentation. So, what is chemotherapy? Chemotherapy is a drug used for the treatment of cancer. Chemotherapy can either destroy cancer cells, or chemotherapy can slow down or reduce the multiplication of cancer cells. Chemotherapy is administered when surgery and radiotherapy cannot reach certain areas of the cancer. Now, unfortunately, in this process, chemotherapy doesn't only kill cancer cells, but damages healthy cells as well, such as gut, mouth, skin, nails, and hair. But unlike cancer cells, healthy cells can recover. And this is what makes patients feel unwell when having chemotherapy. Different chemotherapies work in different ways. So, not all cancers behave in the same way. Therefore, every single patient is given chemotherapy which is individualized for their self, for their diagnosis. So everybody's chemotherapy will vary depending on what the consultant will think will work best for them. Sometimes this can mean a single agent, so one chemotherapy. Sometimes it can be multiple chemotherapies, or sometimes it can also mean a combination of chemotherapy and immunotherapy. But when the nurse gives you a call, she will go through what chemotherapies you'll be having, how long it will take, and how many treatments will be involved in the process. Each one varies in time, so we tend to have some treatments which are 8-hour long, and some treatments that can be anything up to 5 minutes long. But this will be clarified by the end of your new case talk. The doctor's team provide patients with information on the individual treatment. If you haven't received this, you can receive information on your individual treatment on the MACMILLAN website. During the 15-minute consultation, the nurse will go through and discuss your treatment in specific, and this is where you will have a chance to raise any concerns you may have. You may have received a purple card in the post which has appointments on there. On the card, you will have an appointment to see the doctor, an appointment to start treatment, and also some contact numbers which may be handy for you whilst on treatment. Your appointment time will depend on the chemotherapy you are having. Sometimes you may be called in the day before your appointment to change your appointment time in case there is a delay with your treatment. We do try to accommodate longer treatments in the morning and shorter treatments in the afternoon, so we have enough time in the day to accommodate all of our patients. But we do understand some patients may have individual circumstances where they cannot attend that appointment. And if you have certain appointments that you do need instead, please speak to our nurse in charge or ward sister to see what they can do for your circumstance. When attending the suite, please hand in your purple appointment card at the desk. This will alert the nurses of your arrival, and admin will also book in the appointment for your next doctor visit and your next chemotherapy visit. Unfortunately, on the chemotherapy suite, there can be delays to appointment times due to numerous unprecedented events. We do apologise if you are waiting to come in for your chemotherapy, but the nurses are aware that you are here. We do try to keep you updated and let you know what is happening and what the time delays are. But if you have been there for a little while and nobody has come out to speak to you and you are concerned, feel free to find one of our team to explain and look into what has happened. Contact numbers. If you have any questions regarding appointment, general queries, appointment times, something you're not too sure about, please ring the chemotherapy suite on 0116 258 6107. If you have any general queries regarding your treatment which is not urgent, please call your consultant's medical secretary, which you'll be given contact details for. All queries regarding your normal regular medication, long-term conditions, or anything that your GP is supporting you for already, carry on keeping in close contact with your GP to do that still. We do have an emergency line number dedicated for patients who experience problems related to chemotherapy, which we'll discuss a little bit further in the next few slides. You will also receive information details for specialist nurses, dietitians, support nurses, which will also help your journey whilst on chemotherapy. On the chemotherapy suite. Unfortunately, it is a very small suite, and due to health and safety, we do only allow staff and patients in the treatment area. Relatives and friends are more than welcome to bring in family members for the treatment, but they will have to wait in the lobby area until they do finish treatment. Sometimes, in exceptional circumstances, I understand patients may need a friend or family member with them. Please speak to the nurse during your new case talk if this is a case for when you come in for treatment. If you are arriving by ambulance, please alert one of our nurses as soon as you get here to ensure we can arrange a return ambulance for you promptly. Eating and drinking. On the day of treatment, please take your normal medications as prescribed by your GP or doctor on the day of your treatment, unless told otherwise. Please do not fast prior to treatment. All patients should have something to eat or drink before they do come in. There is always tea, coffee, sandwiches, jelly, biscuits, yogurts available on the suite for patients and will be offered. But if you feel you would like to bring in a pack up or bring in your own food, that is allowed also. Blood tests are done prior to every single chemotherapy session. Now, if you have not had chemotherapy before and you are starting treatment, your blood results can be anything up to 2 weeks old. But all consequent treatment after your first one, your bloods have to be within 5 days of starting treatment. What blood tests do is they check that you are well enough to have your chemotherapy and your blood cells have recovered enough from having your last treatment. You will receive a blood form every cycle ready for your next treatment. These bloods can be no older than 5 days. For example, if you are having treatment on a Friday, then the earliest your bloods can be done is a Monday. If you're still unsure on what days to have your bloods, please speak to one of our nursing team. You can have your blood test taken at your GP surgery, and normally if you let them know that every 2 weeks or every 3 weeks on a Tuesday you need a blood test, they tend to be quite accommodating. We also have our walk-in centres, walk-in phlebotomy clinics on all 3 hospital sites. But if you are still struggling to get bloods done properly, speak to one of our nursing team to see what else we can arrange for yourselves. Delay in obtaining blood results may in turn delay treatment. What to expect? Once a nurse has been allocated to start your treatment and your treatment has been checked, you will then be called into one of our chemotherapy chairs. At this point, the nurse will check your details, your information, and check you in. If you need any pre-medication for your chemotherapy, this will then be given to you and your treatment will be set up. At this point, the nurse will notify you of the process, how long your visit will be, what it will involve, and also give you any medications you will need to go home with. If you have any questions regarding any of these things, please raise it with your nurse at this point. If you are unwell, it is really important that you do seek medical help before coming in for your chemotherapy treatment. Whether that is speaking to your oncologist, ringing the emergency line, or ringing your GP, or informing the suite so they can direct you, please ensure you let somebody know and not wait till your treatment date if you are feeling unwell. How is chemotherapy given? So, chemotherapy can be given through a vein in your hand. So what happens is you come into the chemotherapy suite, the nurse will put a small cannula into your hand, and it normally goes in the back of your hand, and this will allow the nurses to infuse an intravenous chemotherapy through your vein. But I must raise, it is really important that if you find any discomfort, burning, stinging, or notice any redness or swelling, notify one of our nurses immediately, as on some occasions this can be caused by chemotherapy. Some patients have a central line inserted into the upper part of the arm, which involves a procedure prior to the chemotherapy. If this is the case, when the nurse calls you for your individual talk, they will let you know. Chemotherapy can also be given as tablets, which is given from specialized trained pharmacists who will dispense it to you and explain to you what it involves and how to take the medication. The emergency line. So, all patients that are having chemotherapy have a dedicated line to discuss any side effects and if they're feeling unwell whilst on treatment. So, if you are feeling unwell, it is related to chemotherapy, it is important that you ring the number which has been sent to you in the post on your red alert card. The number is 0808 178 2212. It is available 24 hours, 7 days a week. If you are unable to get through, leave a message and somebody will call you back within 30 minutes. Side effects. This is one of the most biggest worries and concerns for most of the patients starting treatment. Side effects will vary depending on the type of chemotherapy you will be receiving and also how each individual reacts to the treatment. Although you are made aware of all the common side effects, it is highly unlikely for you to experience all the side effects. Most patients experience some or none of the side effects, but rarely all of them. But we have to make sure we alert patients of everything to look out for so they know what to do if they get any. Ensure you are informing the oncology team of any side effects or problems you are occurring once starting your treatment. Infection. This is another common side effect from starting chemotherapy. One of the healthy cells that you need to fight infections in your body are white cells. And white cells are reduced whilst on chemotherapy. So this can increase the risk of an infection. If you do get an infection and is caused by a low number of white cells in your body, it is known as neutropenia. Infection for a patient on chemotherapy can be life-threatening. This is why it's very important if you do feel unwell, you know what to look out for and you know who to call and spot the signs and symptoms of an infection. We advise all patients to have a thermometer at home before starting treatment. Having a temperature is one of the most common signs of having an infection. This is why we ask all patients that if you feel unwell, for the first check to be carried out is your temperature. This doesn't need to be done daily or routinely, but only if you're feeling unwell. So if you have a temperature is above 37.5, it may be an indicator of infection. You must ring us up and let us know. But also bear in mind that not all patients will get a raised temperature. So if you are feeling unwell and you're in doubt, give us a call and get advice. Please do not take any medication until you have spoken to one of our medical team first, as taking medication such as paracetamol may mask the fact that you have a temperature. This is a small list of things that we ask patients to look out for. So, If you have a sore throat, sore mouth, cough or cold-like symptoms, diarrhea, vomiting, a rash, open area, red or swollen, chills, sweats, frequent urination and burning, these are all signs that it may be a side effect from the treatment. Also, any of the common side effects which are raised on the chemo information sheet, bear those in mind. What we do say to all of our patients is you know your body, you know how you feel on a normal day, and you know when you're feeling a bit rough. So if you are feeling a bit rough and you feel that it is related to your chemotherapy, please make sure you ring the emergency line and get advice. Most chemotherapies can cause nausea and vomiting, not all chemotherapies. So, on some chemotherapies, you are given provisional anti-sickness medication. It is really important that you take medication that is given you for provisional basis, as it is always easy to combat side effects if you start taking the medication prior to getting symptoms. It is a lot harder to manage once you are starting to get symptoms. So, if you are feeling sick, you have taken the medication as prescribed by your doctors and nurses, and you are still feeling sick, it is lasting for more than 2 hours, and you're struggling to eat or drink, please ring the emergency line and get advice. If you have diarrhea, it is important to rest and drink plenty of fluids to stay hydrated. If you have done so, and if you have taken any anti-laxative medication prescribed to you by your doctor, and you're still experiencing diarrhea, which is watery, loose, happening overnight, or lasting for more than 2 hours, please again call the emergency line to get advice. Sore mouth. This is another common side effect from treatment. If you do develop a small sore mouth, this includes mouth sores, redness, white patches on your mouth or tongue, or trouble or pain to swallow, please contact us and let us know. There is an information leaflet in your pack which tells you how to look after your mouth and how to stay well whilst on treatment. We do say to all of our patients, avoid any dental work during treatment. If you do need any dental work, try to have that done before you start your chemotherapy. If you cannot do so and you are having a problem with your teeth, please inform somebody so we can see what's the best course of action once you start your treatment. We also advise all our patients use a soft toothbrush to avoid damaging the gums, along with a gentle mouthwash which is alcohol-free to help keep the mouth clean. If you do wear dentures, please make sure the dentures you are wearing are good fitting dentures. They are not tight, and when you are cleaning your gum area, ensure that you've got no ulcers or red ulcer areas on your skin. If you notice that you have any bruising, bleeding or rashes, please ensure you let us know. So please contact us if you develop any bruising that you cannot explain, if you have any abnormal bleeding, including blood in your urine or stools, heavy nosebleeds, you notice any rashes on your body, please let us know. We also say to all of our patients, moisturize your skin, get your skin in good condition to help avoid any skin irritation. Your skin is a lot more sensitive, so we also advise patients to use electric razors rather than normal razor blades. Hair loss. Not all chemotherapy drugs cause hair loss. When the nurse gives you a call, they will inform you whether the treatment you are having will make you lose your hair. If you do lose your hair whilst on chemotherapy, this is not permanent and your hair will grow back. Okay? So, when you do lose your hair on treatment, it's not only on your head, but all over your body. So this can be eyelash, eyebrows, legs, arms. But like I said, hair loss on chemotherapy is not permanent. They have got the option for wig fittings available. So if you are going to lose your hair and you would like a wig fitting, it is really important you let one of our nurses know so we can refer you over to our MACMILLAN Centre to arrange this. We do advise all our patients, try getting a wig fitting referral completed before you start your chemotherapy, so you have a wig in place before you start losing your hair. Patients on chemotherapy do get discounted rates on their wigs down in MACMILLAN Centre. So if you are not sure, I do say to all our patients, go have a visit to the MACMILLAN Centre based downstairs and they can give you more information regarding the wigs that they supply. We also offer cool caps on some treatments to help prevent hair loss. What is a cool cap? A cold cap is a jelly-like cap, and what it aims to do is once you put the cap on your head, it freezes your hair follicles and reduces the amount of hair that is lost. This depends on individual patients. Please speak to your nurse whether this is something you would be interested in. We do advise all patients on chemotherapy to use a lot more delicate products on their hair, such as mild shampoo, and avoid any heated products on your hair or perming your hair. Fatigue is a common side effect whilst on chemotherapy. If you do experience extreme fatigue, please keep your consultant notified of this. It is very common to feel tired whilst on treatment, so it's really important that you listen to your body, you take it easy, and you do not push yourself too far. Gentle exercise and short walks can help. But if you still feel quite tired throughout all your treatment, please speak to one of our team. Avoid activities that can cause you any injuries. We say whilst on treatment, still carry on going to the shops, theatres, cinemas, going out where you normally go, but just be an extra bit more precautious. So, going when it's less busy, using hand wash, and wearing a face mask. If you have friends and family visiting, asking them, are you well? Are you unwell? If you're not well, please come back when you're feeling better, as you are more prone to getting what they're getting. What do you do if somebody in your house is unwell? The only thing you can do is keep a closer eye on yourself. The first sign and symptom that you're getting what they're getting, or you may have a temperature, you must let us know straight away. If you have pets, see if you can get somebody else to clean up after them. If not, ensure that you wear gloves and wash your hands with warm soapy water afterwards. Fertility. Some chemotherapies can cause infertility, not all chemotherapies. So if you do plan to father a child or get pregnant in the future, you must speak to your consultant before you start treatment regarding your fertility options. We also say to all of our patients, there is chemotherapy present in all bodily fluids. So please avoid becoming pregnant or fathering a child whilst on treatment. Therefore, we do advise all of our patients to use standard line protection whilst on chemotherapy. Eating and drinking. Chemotherapy causes up a buildup of toxins in your body. The more fluids you drink, the more toxins you will be flushing out. So keep hydrated, keep drinking fluids. This does not include tea and coffee. Wash your hands before eating or drinking. These are simple things we should be doing on a daily basis, but please make sure you keep an extra eye whilst you are on chemotherapy. Sometimes we tend to eat food that's gone off by date. We advise not to and just getting rid of it. It does say eat a well-balanced diet, but I say to my patients, you may have a reduced appetite, you may have a change in taste, so eating little and often of whatever you can manage is good. Avoid anything raw and unpasteurized and ensure you're reheating your food properly. If you are still struggling to eat or drink, please speak to our dietitian team or our nurses so we can help support you through your chemo journey. We do advise all of our patients to have a flu vaccination and COVID vaccination before starting chemotherapy. If you haven't had any of your vaccinations, this is not to worry. Please speak to one of our team and they will advise you when is the best time to have your vaccination whilst on treatment. Drinking alcohol. There are a small number of treatments where we advise patients to have no alcohol, but most treatments we say yes to small amounts of alcohol. Your nurse will discuss this with you further on your individual consultation. We do advise any staff on chemotherapy not to go away abroad until they've spoken to one of our doctors first. So if you are planning to go away anywhere, speak to your team before you book anything. If it is sunny, your skin is a lot more sensitive, please wear factor 50 cream, cover up, and stay in the shade as much as possible. If you do go away anywhere in the UK, take your chemo card with you. So if you are unwell or need medical assistance, they are aware of your diagnosis, treatment, and the centre looking after you. We do have the Macmillan Information Centre, which is based downstairs in the Osborne building. They provide a lot of information and support to people with cancer and their families. They have information and support regarding finance, benefit clinics. They also have plenty of information and support groups to help patients and friends and family. Drop in or give them a call to arrange an appointment to see what advice or support they could offer you. Just to go over today's presentation, you will be followed up by a call from one of our nurses on your allocated date. They will go through your treatment in specific and help answer any other questions that you may have. Please feel free to make notes of any questions or concerns that you may have to discuss this with your nurse. Just to remind you, we have 2 telephone numbers, the chemo suite number, which is outlined, and the emergency line number, which is for patients when they are feeling unwell. So, if you are feeling unwell and it's related to chemotherapy, please ring the emergency line. I hope this has given you enough information on what will happen when you do start your treatment. If you still have concerns, feel free to raise this with your nurse or doctor. Thank you for listening and thank you for watching our video. And if you have any questions, we will hope to speak to you soon. Thank you.